An important condition. I am Dr. Malik, intensive care specialist. This is pulmonary aspiration. Pulmonary aspiration. What does it mean by pulmonary aspiration? Pulmonary aspiration is a condition where the patient vomits. He is not conscious. He engulfs. The whole vomiters. Whatever he vomits, he takes into lungs. He breathes into lungs. Most dangerous thing. Suppose he had food, or he had any liquid, or he had any acid, something like coffee, tea, etc., etc. These are all dangerous. Once they vomit and they are not in a position to vomit it out, they are not conscious or they are semi-conscious, the patient just inhales them into the lungs. This is called pulmonary aspiration. Very dangerous. It happens because the lungs greatly get damaged. They become completely infected. Pneumonia will form. Sometimes you lose the patient also, even if the patient is on ventilator. The only thing I advise you is in two conditions it happens. One is anesthesia, one is unconsciousness. In anesthesia, whenever we give anesthesia to the patient, we naturally make the patient unconscious. In this condition, suppose the patient eats something. That's why we say before giving anesthesia, 6 hours the patient must be fasting. 6 hours. Mainly solids, mainly some solid food he must not take before 6 hours, and up to 6 hours. And liquids he can take up to 4 hours, no problem, 4 or 3 hours. Some coconut water or whatever it is, he can take. Clear fluids like water, coconut water is okay for 3 hours. But solids he should not take at least for 6 hours. Why? Means suddenly we anesthetize the patient, we make the patient unconscious as an anesthetist. He vomits, it goes again into the lungs. It can go again into the lungs. That is called pulmonary aspiration, because he is not in a position to vomit out. Very, very dangerous. Number two, in a position where the patient is unconscious, you find on the road the patient had some head injury or suddenly became unconscious because of fits or because of low sugar levels or any reason the patient is unconscious. Suddenly you see a patient unconscious. Turn him to one side. First thing you should do, whatever maybe the patient is unconscious, turn him to one side so that the tongue will come out, should come out, and whatever, if the patient vomits, it should come out. It should come out, it should not go in. So whenever the patient is unconscious in any reason, turn the patient one side and take him to hospital. Don't get him in supine position. He may vomit, and these are all the complications of aspiration, pulmonary aspiration, because very, very dangerous thing is he will vomit and he will aspirate. That is one of the most dangerous conditions, pulmonary aspiration, which leads to pneumonia, other complications, and survival of the patient is